Okay, and we are live at Suzilla.
Hey, it's Matt over there.
And Suzie over there.
Hi, everybody.
And today's topic is how long can you go?
What do you mean by that?
Well, Suzie ran in her little Facebook memories an interesting post. This is literally from September 3rd, 2013. Mm-hmm. And this is exactly what you wrote. The Affordable Care Act, Obamacare, begins October 1st. That's less than a month away. There is a ton of confusion, misinformation, and flat out lies floating around the internet and through the media, and it's scaring folk. I notice that fear, especially of the government, is causing people to do nothing rather than take advantage of this new program. Matt McColm, my beloved husband, for those of you who don't know, has worked day and night for the last few months to become an expert on the ACA. More than anything, he wants to help navigate people through this morass and elevate their fear. Call Matt at his office, and it gives the old phone number. He will help you.
Not only the old phone number, the old phone number.
Yeah, the old phone number. Yeah, because our new phone number is 509-295-9055.
Yeah, so that's, if you want to reach us, that's how you do it. So, my love, that made you think about?
Well, it's one of those things that you know, you don't realize what you're doing when you're in the middle of things.
Sometimes that's true.
No.
It's always true.
It's always true.
It's
you
always true.
Really don't know. Because I've done this, day in, day out for over 8 years now. Mm-hmm. And
I'm in my seventh.
You're in your seventh, so you're.
I'm 1 year behind him, in case anyone was curious.
Yeah, but you know that first year you were a cheerleader at least, so you've helped along the way.
Yeah, yes, I have, and I've done my absolute utmost.
Because I remember in early events we showed up in Quincy with home baked cookies.
Yeah.
And people, giving us the eyeball. It's like, is this a trap?
Yeah, well, cookies are,
home baked.
Come to the dark side. We have cookies.
Yeah, but it's that level of ridiculousn's.
The distrust is there.
It's been there for a long, long time,
and we've worked very hard and built and to build relationships and build that trust.
Mm-hmm. And it keeps growing every year. But it's interesting to see what's going on today with like the vaccine hesitancy.
Mm-hmm. It's a very similar situation.
Yeah, it's very similar.
In the resistance level, yeah.
And that's the why I wanted to bring this up. It's like, well, how long can you fight? I can fight the rest of my life.
Well, as long as your life is good and long, yeah.
Yeah. It's like marriage. It's like, okay, you've got your choice to either give up or die.
Yeah. Well,
divorce or death.
Yes.
That's your two choices in marriage.
Yes. Well, there are people who separate but don't get divorced.
Yeah, and that has some financial problems to it.
Well, yes, of course it does.
There's
different problems to every situation.
But yeah, so
yeah, and the thing is about marriage is, a marriage that lasts is no one gets out of here alive.
Yeah,
and that's our plan.
For better or for worse.
For better or for worse, here we are. So yeah, I mean, things have changed, but they haven't changed. The more they change, the more they stay the same. Is that the old
yeah?
Yeah. Because, we've been at this for the Affordable Care Act is coming into its 9th season. And starting November 1st, they've shortened the enrollment periods have shifted a little bit over.
Yeah, because more people are that need it should be enrolled in it. We finished out a massive special enrollment season. Mm-hmm. They're getting ready to open the gates probably in another month or so. Mm-hmm. For the child care workers.
Right.
If you work in a licensed child care facility in Washington State and you make a certain amount, then if you select a certain plan, a certain silver level plan, you get it at zero cost to you.
Right. You basically get free health care. for your premium. It's a free premium, but you still have like copays and stuff.
Yeah, but there's certain things you can get, your annual checkups.
Yeah, your well person checkups, your vaccinations, your preventative care stuff is still covered 100% by the plan. You're not getting a garbage plan for zero premium.
Yeah, so it's a pretty awesome program that's going to help a segment that is really important to our economy.
It is.
Because that's one of the big fights over, back in DC land is, how do we get, cost of child care down?
Right.
And, how do employers get plans to, better incentivize their employees?
Well, not only that, but it draws employees into that industry.
Correct.
Because, oh, wow, I can take this job and get benefits that are affordable.
So
there's a lot of positives to this one. I imagine somewhere there's a negative. I haven't really looked deep enough to see if there is one.
About the worst is the implementation of it.
Yeah, the way they've got this set up to start is a little weird, but we're making it work.
Yeah, we're going to make it work. And we're
question for you.
Okay.
The childcare thing, is that a Washington state or a federal thing?
That is a Washington state thing.
Okay, so it doesn't count if you're like in Nevada.
Correct. This is Washington state. A bunch of legislators got together and said, hey, we want to do this program, and they'll expand it out in 23. We will keep you abreast of that next year.
Yeah, we're going to keep you.
However, they said, okay, we're gonna let one lead organization have the magic keys to make it happen.
Right. So, and they're grouping out of Yakima, and they get the job done.
And they said, hey, we're gonna push them, close to $500,000 to get it done.
Yeah, they threw a lot of money at them to start this process and organize their people for it.
And they're the ones with the final switch, because you got to say, okay, how do you prove someone's in a licensed facility?
Exactly. That's a little tricky. And that's what these guys they're gonna have the tools to do the documentation for the.
They're gonna have the tools to do the final documentation, right. Now, and that's very key.
Right.
And
you can't just pretend you're working for one.
So what we're doing is we're saying, okay, that happens on open enrollment.
Mm-hmm. So
not everyone's going to ask those questions. So if we get someone earlier and we set them up, we're going to basically hand them over on a silver platter to these folks with everything all ready to go to make it as smooth as transition as possible.
Exactly. What we're going to do is we're going to facilitate your enrollment with them.
Mm-hmm.
We're going to get the account set up. We're going to get things basically started, and then let them finish.
Well, it's not them finish the details. They are the only ones that can flip the switch.
Well, yeah,
it literally requires programming to do this.
I know this, dear. What I'm saying is, we can get your file set up and up to date and ready to go. So all they have to do is flip the switch.
Mm-hmm.
We're facilitating.
Correct.
Yes.
It's what we do.
If we're your broker, we can also help with any kind of customer service after the fact.
Yeah, and that's the big key difference. So we've started the outreach for that, because it's incredibly important to get that part, because it's going to take place during open enrollment for both Medicare and healthcare.
Yeah, it's going to be fun.
So yeah,
the thing is, it does dovetail in with individual healthcare. It's just an extra. It's a couple of extra big steps.
Well, that's the important thing with the implementation of things. Mm-hmm. We saw that this year with the added bonus of unemployment.
Mm-hmm. That was huge.
And because if you don't know,
mm-hmm. You haven't been listening.
I literally had someone yesterday not know that their premium downshifted, and it was costing them hundreds of dollars less a month last June.
Yeah, it dropped. Their premium dropped about $300, and they didn't really notice it because they're doing auto pay.
And it was like, this happened, and when you get a job, you need to report that income because it's going to cost you more. And that's no big deal, because it's not a 1-for-1. It's like, I make, an extra $50, so I pay an extra $50 for healthcare. No.
It balances out.
They
were afraid they were going to lose their subsidy entirety. the subsidy shift was they were looking at making about another $15,000 a year, taking on a part-time position.
Correct.
And what they did is they were afraid that would disqualify them from all the credits. It didn't. Ran an estimate, and it took about $200 of credits off of her already significant credit boost. So there was still a lot of savings to be had.
Yeah, and we're talking because of the American Rescue Plan, which is in effect through 2022.
Yep.
They took away the cliff, the subsidy cliff,
the financial cliff. That if you were making over 300% of
400%,
over 400% of poverty level, you basically fell off the cliff and you didn't get any credits. They shifted that so they can't charge you more than 8.5% of your income. If you want that to stay past 2022, talk to your legislators.
Correct.
Because they're the ones that have the power on that one, and it's awesome.
So yeah, and this stuff is complicated.
It is.
One of our famous lines is we're going to let the computer do its job. Sometimes, like for the estimator, the computer could be a little bit off from the actual.
Mm-hmm.
The important thing is the quote. Once you do the finalized quote, that is real. You don't have to accept it.
No.
You can cancel it.
Yes.
You can change throughout the year.
Yes. You're encouraged to make sure that your income is updated over the course of the year.
Correct. Do not play the game of, let's wait till November and say, I'm going to add $30,000 to the income and expect you not to be paying those tax credits back.
Yeah. You got to pay attention.
You got to pay attention along the way. Yes, if you get a huge bump of income at the end of the year, yes, you will pay back those tax credits.
Mm-hmm.
Because it's a balancing act.
It is. And everybody we talk to in our office knows that if they're listening. That's just because that's the rules. And we got to follow the rules. You can try and play the game, but they will ask for that money. You can't just pretend that you're not making as much, because the IRS looks at your tax return and they look at what you declared as income on your application, and they reconcile it.
And that's the important thing here, because here's the thing: we don't reconcile.
No, it's not us.
Not us.
Nope.
So we're going to see similar things with the mandates, the COVID mandates.
Yes. Well, we've already had people lying about that.
We have. And there are. I know there was an Instagram gal that was making $100 to enter the data into the New York system. That's up on felony charges.
Yeah. Well, how about the pharmacist who is selling the fake cards, and the gal who forged a card and spelled Moderna wrong?
Yeah, or the parents that went to Hawaii and had their
forged cards for their under 12 kids.
Yeah. Here's the thing. There are laws on the books about doing this. Yeah. Law enforcement that does law enforcement is, has those things, and there are some significant penalties.
Yes.
For breaking those. Yes. And that is really important to note, because I am Dominic Bonney is one of our local journalists. Uncovered a couple churches that were getting together saying, hey, we're gonna show our members on how to bypass the vaccine mandates.
They're gonna try and throw down religious exemptions.
Yeah, and the religious exemptions are there for a legitimate reason.
These are not what's being thrown down by these churches is a political reason, not a moral objection.
Correct. And you can tell if it's a moral objection is if they objected to the vaccine mandates that the public schools have had for years, that the military's had for years, that employers have had for years. These are things that normal public has to deal with regularly.
Yeah, there's like two major religious sects that have had from day one religious objections to immunizations.
Now, there was one
But
that you
I now
named.
cut my head.
You mentioned the what was it, Church of Science?
The Christian Scientists.
Christian Science.
Mm-hmm.
Now, that was an interesting one.
Why?
Because I caught an interview with them.
Uh-huh.
And they were like, why we don't mandate it, we believe that it's a personal choice. Whereas the Catholics and the Church of Latter-day Saints have come out and said, yes, we support the vaccination efforts.
Whereas these Christian Scientists are saying we are remaining neutral on it as a religious body.
Correct.
You choose. So they're not going to give someone a hard time if they do get immunized, and they're not going to give someone a hard time if they don't get immunized.
Correct.
They, as a religious group, are remaining neutral.
Correct.
So therefore, the groups that are here locally, they're not remaining neutral, clearly. And this isn't about religious freedom. This
Correct.
isn't about, choice. This is about politics.
Yeah.
And last time I looked, the Constitution had this whole thing about the division of politics and religion.
Well, it goes into the tax laws.
Oh yeah.
So that is going to be a real interesting thing that they're probably going to have to sort out, of whether they want to be a nonprofit church or a profit-seeking organization.
Because right now they have got a tax exemption because they're a church.
Correct.
But their behavior is not following those rules per se.
So that would be a determination of the IRS,
who has generally been pretty hands off on those conversations.
Correct. Because of how we have as a nation has said, hey, these organizations that do these backup checks, let's scale back their funding. So they got less inspectors or less people to double check. It's like that, I think there's maybe one or two meat inspectors in the area.
It's pretty rare.
We had stripped down auditors.
Yeah.
It's why
it's just a matter of what's happening is the funding for the staffing is constantly being cut. So you have to self-inspect.
So
which someone's going to say ha and move on.
Well, it depends on your ethics, because this is an ethics thing.
It is an ethical thing. We also know that there are a lot of unethical people out there running businesses. It happens.
It happens
every day. There's entire industries based on unethical practices. Go back to New Jersey and look at the trash collectors and the mafia and all that ancient rigmarole.
Well, that's fine and dandy. However, we're not dealing with that. We're dealing with the police.
There is that.
Our
local groups.
The police are charged with serving and protecting. And I'm sure that that there's some auditors out there for those organizations to make sure that they do their job effectively or move on. It's like any industry out there. In our industry, we have the Office of the Insurance Commissioner,
right?
Who they make sure that we do our jobs, and if not, we move on.
Right.
So yeah, that is how things roll. But yeah, the fighting the ton of confusion and misinformation and flat out lies. So the question is, are we ever going to change as a nation? Because we haven't in 8 years. Away from the misinformation. No,
it's gotten worse.
So
between when I made that post 8 years ago and today, the dissemination of misinformation and flat out lies has gotten worse.
Okay, so you say it's gotten worse. So how What was done to make it worse?
We started having people use the social media as a tool to spread that information on an industrial level. There was entire companies usually offshore, devoted to flooding social media with misinformation and lies. And our politicians sucking it all up because it was benefiting them with no penalty to speak of.
So you blame the lack of penalties.
Okay, I guess so. And the encouragement from those who are involved in who ostensibly benefited from it. If you want me to name names, I'll name names. It's Donald freaking Trump.
Well,
he did.
Yes. However, that's not the two churches, for example. That's a local level.
It is for now.
And yeah, it creates a little pocket of people who want to.
But even the little pockets were emboldened by the big pockets that got away with it. If they can do it, so can we.
So how do we counter that? How do we move away from that if you want less fighting? Because I'm like, yeah, I can fight the rest of my life.
Yeah. Okay, I'm not saying we want less fighting. We want the truth out there. And not just the alternative facts. We want actual, honest to goodness, this is the truth. And how do we get that to happen? It's hard because this country seems to be embracing the liars or not recognizing the lies when they're seen.
Well, if they embrace the liars, are they embracing experts?
No, they're not.
So you could simply do a simple shift in your thought process of doing that. Hey, this individual is continually lying or continually putting out misinformation. I'm going to take whatever they say as a grain of salt.
Yeah. And
shift over to someone that has been trained.
Oh, hon, people have been trying to get other folks to do that for years. And then we get told that science is an opinion. And that my expert who read things on, who's watching YouTube videos about people, made up by people who are just pushing their own colloidal silver agenda, they're the experts. They know everything, but the person who actually does peer-based science-reviewed studies, they're not the real experts. How do you counter that kind of ineptitude? That's not the right word. Belligerence.
Well,
how do you counter that? Somebody who refuses to listen.
My favorite for that is it actually came out in the Kansas School Board over creationism.
Okay, so we're talking all the way back to the Scopes trial?
80s did this.
Well, okay. Well, the Scopes trial was about creationism.
No, this was actually the Kansas School Board.
Okay.
And they did the creationism must be taught with Darwinism.
Right. They were trying to do the equity thing.
And it's a very false equity.
It is.
They're saying, okay, well, hey, you've got to support, you've got to lead, have equal credence to creationism with Darwinism.
Right.
And someone pointed out in their brilliance that, hey, that means this, you can have this flying spaghetti monster and have to be taught equally as well.
And that's where the flying spaghetti monster came from. Right.
Now, you're not going to have, if you roll into the doc to have a freaking heart surgery, you don't want someone that, is a car mechanic working on your heart. You want someone that's a trained heart surgeon.
Yes. And
while your car mechanic might have some good ideas about virus, you're not going to go to them and say, "Oh yeah, I'm going to follow what they found on YouTube."
But guess what? People do every day. Every day. And I don't know how to convince them to listen to their doctors.
It's really simple. All they got to do is shift.
That's not simple.
Yeah, it is.
How do you get someone to shift then? If they
You don't get someone to shift, they shift.
But why would they shift?
Why would they shift?
Yeah.
Because they're tired of the game.
Okay, we're getting a little deep here.
Well, no, that is the absolute truth.
Okay.
Is they have to be tired of the fight.
Well, okay, so it's not. There's nothing that an external source can do to encourage them to be tired of the fight.
Oh yeah, there is.
Just keep fighting.
Yeah.
Wear them down.
You wear them down.
Yeah.
That is what happened with Milo and the little freedom speech guys that were going around in 2017.
Mm-hmm.
They were pushing the whole, we've got the freedom to talk horrible things about, letting people commit atrocities.
Okay.
All under the guise of freedom of speech.
Mm-hmm.
They were taking zero responsibility.
Mm-hmm.
It's not protected speech. And large groups of individuals took up the Antifa, the anti-fascist mantle, and went nose to nose with them. Mm-hmm. And they made it so it wasn't fun to do those events anymore.
That's true.
That was the only thing that stopped them.
It didn't. They didn't stop them. It drove them to a different angle.
No.
Well, that particular group, to a degree, sure.
Milo is no longer giving speeches.
Who's Milo?
Milo, Stefan, it's big. I'll massacre the name.
Okay, so some dude.
He was an alt-right individual for years.
But the alt-right's not done yet.
However, to wear out some of those individuals, that's what it took, was not giving up the fight, not giving ground.
That's what this whole topic is about. Don't give up the good fight.
As RJ told me years ago, who's our partner, is don't lay down your sword. Yeah. And that is very important. When people say, I'm burned out. Well, why are you burned out? Are you suffering from a conflict of ethics?
Make them analyze what's wearing them down.
And because the whole 94% of all the doctors are vaccinated. The staff are considerable. Why is that? Well, because you've got divisions in that healthcare system. Mm-hmm. You have status.
That's absolutely true.
And they're not communicating with each other, and they don't respect each other. And that's why you have that division. It's not a huge number. If you look at the hospital, the protests against the mandates, it's not a huge number that is protesting, and it's largely fueled from the outside in grassroots organizations.
Yep.
In Texas is a great example. The Methodist health system down there. Mm-hmm. Out of over 21,000 employees, it was down to a little over 100 that were protesting.
All right.
So we're not talking a serious percentage. Up in Canada, you're seeing some protests. However, the vaccine passports up there are being driven by the business people.
That's exactly right. And that's where things are going to start. And that's happening in a couple of counties here in Washington State.
Correct.
That's going to be interesting. I'm really kind of excited to see how that plays out.
So, when someone says, this is required for you to work here. Yep. They've had that since literally Valley Forge.
Yeah.
They've had vaccine mandates.
Yep. Is that our time?
That's about our time. So yeah, how long can you fight? Well, some of us can fight forever.
Well, here's the thing. If you need a break, take a break. Others will pick up the mantle, and then you come back in and take your sword back up.
Yep. So hey, have a good day out there. It's going to be a fun one.
Enjoy your long weekend. It's Labor Day.
It's Labor Day. So yeah, like I said, we've been doing this for a long time,
and we're not going to stop.
Nope. And because
we're having fun.
We're having fun. And Suzie says it's not going away. But here's the goofy part. We keep growing each year.
It's true. We still got people who are loving us.
Yep. So bye. Have a good one, and peace out for now.
Hasta luego.